A single mistake in data annotation could change lives, especially in healthcare. The hidden dangers of data annotation biases are more serious than you might think. Every misclassified dataset sends shockwaves through patient care, diagnostics, and treatments. Imagine a doctor relying on an AI tool to identify tumors. If the training data is biased, crucial details might be missed, leading to misdiagnosis. You could be the one affected by that oversight. When annotators make subjective labeling choices, they unknowingly introduce their biases into the A. A seemingly harmless decision can snowball into a major issue, like a secret note that alters the entire story. Consider a healthcare application trained solely on data from one demographic. What happens when it encounters a patient outside that norm? The A falters and lives are at stake. Yet, this problem often goes unnoticed. How can this happen in a life-saving field? The pressure is immense. Annotators, racing against the clock, might cut corners. This isn't just about technology, it's about human judgment, and that's where the risk lies. As we push for faster innovations, the chance of overlooking these biases grows. Behind every data point is a real person, and the stakes are high. Now, here's the urgent part: what if these biases are so deeply rooted that they can't be easily fixed? We face a future where AI systems amplify existing healthcare disparities. This isn't just a possibility, it's a looming reality. But there's hope. By enhancing training for data annotators and prioritizing diverse datasets, we can begin to close this gap. It's a challenge we must confront head-on. Every data point carries implications beyond its numbers. It's about lives, trust, and the future of AI in healthcare. Stay vigilant for those data annotation warning signs; they could save lives. Imagine a world where AI makes crucial healthcare decisions, yet it's built on biases you might not even realize. Sounds alarming? Right. This is happening right now, with risks hiding in plain sight. You might think data annotation is just about labeling images or tagging information, but those labels can lead to filtering mistakes. Imagine a medical AI trained on data that overlooks certain demographics. Would you really trust it with your health? Let's dive deeper. Data annotation is merely a technical task. It's subjective and can be influenced by human error and bias. If the person labeling the data comes from a different background than the patients being analyzed, the results could be skewed, affecting diagnosis and treatment plans. Now, let's make this personal. Picture walking into a hospital, and the AI misinterprets your symptoms because it was trained on a dataset lacking diversity. The consequences could be severe, like a misdiagnosis or delayed treatment. That's not just a minor issue, it could be a matter of life or death. So, how did we get here? It starts with the misconception that data is neutral. In reality, factors like socioeconomic status and cultural differences shape how data is collected and interpreted. If you believe your health data is free from these biases, that's a risk you can't afford to take. Here's the twist: it's not just the AI's fault. Many developers overlook these biases during training, often without realizing the serious implications of their choices. This lack of awareness can lead to healthcare systems that fail us when we need them the most. But don't lose hope. Awareness is the first step toward change. Involving diverse teams in the annotation process can help identify blind spots, and conducting real-world tests with varied datasets can reveal flaws before they become critical. This isn't just about fixing A, it's about ensuring our healthcare systems are fair and effective. As we wrap up, think about your own healthcare experiences. Have you ever felt misunderstood or misdiagnosed? These moments matter and highlight the urgent need for improvements in A training. We all have a role in advocating for transparency and accountability in healthcare A. Don't wait until it affects you or someone you care about. Stay informed and hold these systems accountable. In the world of A, every label counts, and the hidden risks are more real than you might think. Imagining a world where a single mistake in data can have life-changing consequences. It might sound dramatic, but this is a reality in healthcare A today. You might wonder, what could possibly go wrong? The truth is, this issue goes beyond algorithms. It's fundamentally about trust and safety. Every day, data shapes the decisions made by healthcare professionals. However, hidden biases in data annotation can lead to serious errors like a ticking time bomb that most of us don't even notice. Data labeling is often performed by humans who carry their own unconscious biases. If a data annotator mislabels a critical piece of information, the A learns from that mistake. When that A is applied in real-life situations, lives are at risk. Now, imagine a patient arriving at a hospital with symptoms that could easily be misinterpreted. If the A assisting the doctor has been trained on biased data, it might suggest an incorrect diagnosis, leading to dire consequences, all stemming from something that seems innocuous: data annotation. But let's dig deeper. It's not just the annotators to blame. A complex web of factors contributes to these hidden risks. The dataset might be incomplete or lack diversity, and vague annotation guidelines can lead to varied interpretations. Each of these issues can skew the A's understanding, and that's where the real danger lies. You might be wondering, what can we do about this? It's not as simple as just retraining the A. We need a fundamental shift in how we approach data collection and annotation. This means creating clearer guidelines, ensuring diverse representation in training data, and crucially, raising awareness about these biases. As we navigate this complicated landscape, it's vital for all of us to recognize our role. Whether you're a developer, a healthcare professional, or just a concerned citizen, awareness